Heart disease is the leading cause of death for women in the U.S. As part of Heart Health Month, there are a few questions women should keep in mind when visiting the doctor. Dr. Keary O'Connor from Primary Care Plus joins us today with the important questions women should ask. Good morning. Thank you so much for joining us.
Good morning. Thank you for having me.
Well, women have a lot of questions when it comes to their heart. Like, is heart disease the same thing as a heart attack? That's not necessarily true, is it?
It's not, but it can be. It can be heart attack or stroke, but it can also be something like an infection, a congenital heart defect, hypertension, or heart arrhythmia.
Yeah, when your vessels narrow, you have a problem.
Correct, yes. When the vessels narrow or when plaque builds up, and those are the arteries that feed the heart, then you can be in trouble, and that can increase your risk for heart attack and stroke.
Okay, so if we don't have any of those problems right now, we go to the doctor, what can we do to make sure that we don't become one of these statistics?
Great question. So you want to find out about your risk factors. And your risk factors include poor dietary intake, not exercising, smoking, being overweight or obese, having high blood pressure, high glucose, and high cholesterol.
And these can be life-threatening conditions, especially when it comes to your heart. But if you start early and do proactive things, you can kind of really save your life. What would you recommend?
You can modify those risk factors, especially knowing your numbers, understanding your glucose, your cholesterol, and your blood pressure. But you can also start exercising. You can reduce your weight to a healthy range, adopting a whole foods plant-based diet. Things like eating fresh fruits, vegetables, whole grains, plant-based proteins such as beans, peas, lentils, tempeh, nuts, and seeds.
So are there questions maybe that we should ask, like 10 questions we should maybe ask our doctor, or anything specific that we can say to them to get the answers that we need? Yeah,
so ask them, what is my blood pressure? What is my cholesterol? What is my blood glucose? What are my risk factors? You know, what risk factors do I have today? Do I qualify as being overweight or obese based on body mass index?
Wow, what is my blood sugar level? That's the same as glucose, right?
Correct, yes.
And if you get the answers you don't want for these questions, like they always say, you need to lose a few pounds. Well, that's easier said than done. But again, reiterate, what's the best method of just trying to lose weight if you have that problem? So
there are two things. First is a heart healthy diet, which can include a whole foods plant-based diet, but then also exercising. You want to aim for 30 minutes of exercise most days of the week. And that can be as simple as a brisk walk around the block or jogging in place while you're watching television.
Even 10 minutes at a time is better than nothing, right?
Correct. If you can break it up in 3 segments, 10 minutes at a time throughout the day, that's perfect.
All right. We got to keep these hearts healthy.
Yes, ma'am.
And thanks for helping us do that. Dr. Keary O'Connor, thank you so much for coming on.
Thank you for having me.
All right.